In this module, we'll go over some new practices and protocols for aerosol management in your office. The dental profession is mandated to sterilize instruments, disinfect surface contaminants, and use precautionary protocols such as PPE and intraoral aerosol management. However, indoor air quality and extraoral aerosol management have not been emphasized as a priority until now. The importance of managing air quality and aerosols to prevent the spread of viral and bacterial infections must now be part of our daily precautionary measures. Next, we'll go over what BDG is doing to help minimize aerosols in your office. Let's begin with source control, which is the most effective way to reduce aerosols. This includes the use of a rubber dam, dry angles, and HVE systems. These methods have proven to capture 90 to 95% of intraoral aerosols. We've also implemented a pre-procedural antimicrobial mouth rinse. While this doesn't reduce aerosols, it does reduce the levels of oral microorganisms in those aerosols. Another way to help manage air control is by maintaining the centralized HVAC systems in each office more frequently. The air filters are rated for replacement every 6 months, but your offices will receive maintenance every 3 months. Hydrogen peroxide at a concentration of 0.5% or more is proven to effectively kill viruses. So as part of the sterilization protocols in treatment rooms between patients, we will be adding a step that includes use of a peroxide-based spray. After the first wipe down of the treatment room, the peroxide solution will be sprayed in the air surrounding the patient chair. Then the room will be wiped down a second time. While the effectiveness of this method isn't yet proven, we are taking extra precautions to help layer our methods to reduce risk. Next, we'll introduce you to the new HVE systems that will be available in each office.
One of the most prominent features of the PureVac HVE system is its reduction of potentially harmful aerosols. In a research study, HVE removed 90% more aerosols compared to a low-volume saliva ejector. The PureVac HVE system helps to remove these aerosols before they can do harm. One of the most noticeable features of the PureVac HVE system is its fog-free mirror tip, providing indirect vision and illumination with rounded, smooth edges for retraction. And the PureVac HVE tip is completely autoclavable, up to 100 cycles. This unique 2-in-1 instrument allows you to evacuate fluid and debris with one hand, all while facilitating retraction, visibility, and illumination during multiple procedures, such as ultrasonic scaling. And according to clinicians in a recent user study, with 2 devices in one instrument, you can increase overall efficiency. With the Dentsply Sirona PureVac HVE system, you now have less aerosols, easier maneuverability, and better visibility. A system that can change the way you handle your dental procedures every day.
Relief is easy and efficient to put together. Let's review the parts and pieces that come with the product. You'll get a clear plastic high-volume coupler. This is the portion that inserts into the top of your high-volume suction in your operatory. Next is a 48-inch high-volume hose, giving you plenty of reach and convenience no matter what your operatory setup or equipment is like. The next piece is a Quick Connect adapter. This allows you to separate the 8-inch Quick Connect hose from the longer 48-inch high-volume hose so that you can leave the 48-inch hose and the HVE coupler attached in the operatory and simply remove the 8-inch Quick Connect hose, the U-shaped connector, and the leaf-shaped mouthpiece in between each patient. The 8-inch Quick Connect hose then connects to what we call the U-shaped connector, and then you have your leaf-shaped mouthpiece. Let's quickly watch a video of putting this together in a standard operatory. We have our HVA coupler, our 48-inch high-volume hose, our Quick Connect adapter, and our 8-inch hose already connected. We've now inserted the U-shaped connector, and to the U-shaped connector we're actually going to now insert the leaf-shaped mouthpiece. Once that's been firmly inserted into the U-shaped connector, we're simply going to take the HVA coupler connection, insert it into the top of the high volume suction, and our Ivory Relief is set and ready to go for the next patient. Relief is easy and comfortable to position for the patient. The leaf-shaped mouthpiece is placed inside of the patient's cheek between the buccal of their teeth and the inside of their cheek. The U-shaped connector will hold it in this position, keeping the tubing out of the way of the operator. The high volume can now be turned on and we can begin our procedure. The Ivory Relief is suctioning at such an efficient level that the patient does not feel compelled to have to close and swallow, and we don't have to stop the procedure continuously to suction the patient's mouth, allowing my hygiene procedures to be more convenient and efficient and comfortable for the patient as we complete them. For ease of use between patients, we can simply disconnect at the Quick Connect, removing the 8-inch hose, the U-shaped connector, and disposing of the leaf-shaped mouthpiece. Once everything has been wiped down and sterilized, we can simply replace the 8-inch hose, the U-shaped connector, and insert a new leaf-shaped mouthpiece for use with the next patient. One of the things we love about Relief is that patients can actually go ahead and close and they can evacuate their own mouth, much like they've become accustomed to with just using a saliva ejector. The difference is this is highly efficient as we don't have to keep taking it in and out of the mouth.
While aerosols can't be completely eliminated from our work environments as dental professionals, these additional methods and precautions are meant to reduce them to help keep our team safe and healthy while serving the needs of our patients.